Hello and welcome to the Activities of Daily Leadership, or ADL podcast. I'm your host, Hannah Mueller, third semester OTD student. And today I have two special guests in the studio with me, Dr. Virgo and Martin. Dr. Virgo is our first guest today, and she is my OTD advisor. I consider her a vault of mental and behavioral health research. She's here today to talk about a time when she experienced conflict in the workplace and how she handled that conflict as a practicing OT. Dr. Virgo, thank you so much for being here. You have the floor. Please take it away and tell us about your conflict scenario.
So, I was working at an interdisciplinary pediatric outpatient clinic. I had already been an OT for probably 10 years at this point, so I was not new to peds. I'd only been at this clinic for about 2 years. So the disciplines in the clinic, OT, PT, speech, counseling, and social work, and they saw all ages. So we could have clients as young as babies all the way up to adults and older adults. I had a client who was probably about 4 or 5 years old, super sweet little girl, but really struggled with attachment to her parents and transitioning between activities. So we had been working for quite some time, probably 6 to 9 months at this point, on just her separating from her parents and being in a session with me by herself. Mm-hmm. So I had a coworker at the time. She was a counselor. I think this was probably like Saturday morning. And I say that because much fewer people in the clinic at the time. So my coworker counselor, she was waiting for her client to show up, and as I was bringing my client from the sensory gym to my treatment room, my counselor coworker saw us and started engaging with my client, which is like, oh, that's great, social participation, right? But my client has a very hard time transitioning, and so she is happy to get off track. Mm-hmm. My client is happy for someone to distract her. She doesn't want to come to the therapy room, and so I am trying to get her to transition past this counselor. Counselor is not picking up on my social cues that this is not an appropriate interaction at this time. So it prolongs everything, makes it more difficult for me to get my client into the session, and then once we finally get to the session, it's like, now we gotta re-regulate. So that was one instance. Same counselor, another Saturday morning. I have my client, same client, we're out in the waiting room. There's nobody around. It's just me and my client and her parents, and I'm talking to the parents about how our session went. Counselor appears. She's waiting for her client. Her client isn't there. She proceeds to take my client and walk her away to a different room. Like, we had 2 separate waiting rooms. They were kind of spaced apart. She took my client and walked to a different room with her to play with her and engage with her, and I'm like, what are you doing? Like, you can't just come and take my client. And so I'm like really stressed out about that. So between these 2 different instances, and then several other situations with this counselor, she had a very strong personality. She's very confident in her abilities as a counselor, could come off kind of pushy. To me, she did not have great boundaries, and not great situational awareness. So I'm like, I have to have a conversation with her. The most professional thing to do would be to address this directly, which is not a strong suit of mine, like even now, but back then I'm like, I really have to push myself. So I did invite her in, like, let's have a conversation. Just wanted to share with you that, you know, it was kind of difficult for me to transition my client when you engage with us in the hallway. Also, it was kind of inappropriate that I probably didn't use the word inappropriate. I was a little taken aback that you took her away from us when we were transitioning at the end. Like, can you please talk to me before you do those kinds of things with my client? We're working on some skills that make it really hard for her to transition. She wants to get distracted. She's having a hard time with boundaries herself, so like I really need to model this to her. The counselor was very surprised. She thought, like, it didn't make sense to her that for me, because we're OTs, right, every minute is functional. Like, from the minute she walks in the door to the minute she leaves, that's my session, especially for a client that has a hard time with transitions. Now, for a counselor, they only do the session is when they're in the room, theoretically. So, you know, I'm sure they're picking up on things from their client while they're walking back. But anyways, their therapeutic hour starts when they get into the treatment room. And so trying to get this counselor to understand the different roles felt really important to me. I don't know that she wasn't apologetic. I think she was trying to hear what I was saying, but really had an attitude of like, well, that's not how I would do it, so it's fine that I was doing what I was doing. And it's like, I don't know. I think she respected me a bit more after that, just that I was willing to push into the conversation with her. But it can be really difficult. You know, you go into these interdisciplinary spaces and the word might not be interdisciplinary. There are other words, right? Where like you all work together in the same building, but you might not be like integrated, if that makes sense. Like you might not share a client, but there are all these different disciplines in the building. But for us to understand each other's roles and what a session could look like, I think that's really important. She actually happened to be a special education advocate. I'm not sure if you know what that is. Okay. Her son has autism, so she's familiar with OT, but in like a way that they're the client, right? So I think she had ideas of what OT should be, and that's not how I practiced OT. I'm a little more outside of the box in how I think about it. Like some kids, therapy starts when they enter the parking lot because getting out of the car is hard, right? So just being able to have a conversation, knowing you won't necessarily change a mind or change a perspective, but really advocating for what's best for the client, that's where it will get me every time. Is if this is interfering with my client's progress, my personal discomfort doesn't matter anymore. I have to do what's best for the client. That job specifically was how to be more direct. So I like to feel a person out and see like what is your conflict style, like, and then I try to adjust and meet them where they're at. But then sometimes I worry that I'm getting lost in details. So analyzing my own communication pattern would be a leadership, I think I'm answering this accurately, a leadership strategy so that I can engage most effectively with the person that I'm talking to. In that particular clinic, there were a lot of people who pushed boundaries, and my style of communication of like trying to figure you out and like let's figure out the best solution, it wouldn't work. I had to become more forceful and very direct. I don't have a threatening voice. People are not afraid of me. They don't, like, Alexa won't pick up my voice when I ask it a question. Like, I don't have that kind of, that's hard for me to use my voice in a way that people will listen. So I really had to know that about myself too.
With that in mind, how do you think this conflict should have or did shape the culture of the clinic, if at all?
Sure.
And in what ways do you think culture needed to shift?
Sure. So I would say it probably didn't shape the culture of the entire clinic. And that's an interesting one. I think it shaped the interaction I had with that counselor, but there were times that I questioned retrospectively, like, should I have also taken that to my manager and made her aware, like, this person is stepping out of line, like, you shouldn't be, it would never be acceptable for me to approach a counseling client. Like, why was that okay for you to approach an OT client? There's some sort of power differential there, but I never did talk to my manager. My manager was also a counselor who also had problems with boundaries. So it was intimidating. But then there's my personal belief of, like, I need to come to the person I have a problem with first versus talk around them. So I think if I were to do it again with knowing what I know now, I would have also talked with my manager, just to let her know, like, people need to understand each other's roles so that it could shift the culture a bit. And I do think she would have been open to that, like, everybody understanding each other's roles more, but I didn't approach her, so yeah.
How do you feel that conflict on that day affected your ability to walk into that treatment session with your client and give skilled services?
Yeah.
And what, if any, strategies did you use to emotionally regulate yourself in that moment?
Sure. I know I was very flustered. I do think that I have a strength of being really present with my clients. So having practiced for so many years already, being able to focus on the client, leave myself out of it a bit unless it's therapeutic. So I have a really strong philosophy around that. That helped me. I know that I felt flustered. I can picture myself walking down the hall, and it's like, how do I pivot now? Because that transition took 10 minutes when it was supposed to take 30 seconds. Like, how am I going to rearrange my session? So that's stressful, though admittedly it's not as stressful when I'm a 10-year veteran versus maybe I'd just been out for 10 months. That was a whole different... Anyways, flashbacks. When I remember having a situation like this when I was a newer grad, and it derailed things for the rest of the afternoon. Coworkers noticed, right, and they let us help you out. I didn't need that level of support by the time I was in this position, so I feel like I was able to flex, but definitely had to think on my feet and change what I was doing the rest of the session. And then there's the interpersonal anxiety of I have to see this coworker and figure out how do I want to interact with her the rest of the day, right? Because she walks past my office throughout the day to get to her own. So then it becomes more about that interpersonal conflict, and how am I going to handle my other clients when she's trying to interact with them. I think that session ended up, it was longer than it needed to be because of the transitions, but I'm grateful that I was able to pivot. It's really the ruminations for me after the fact.
In this specific scenario, how did leadership guide the decisions that you were making, specifically in that interaction with your coworker?
Definitely. So I would think, and sorry, I teach a leadership class, and I'm like, what terms can I use here? So I'm speaking in very layman's terms right now. I have my own personal philosophy of how I want to interact with my coworkers. I want to be professional and ethical, and I want to lead by example. So, I was, when you feel anxious and vulnerable, sometimes it's easy to want to go complain to your other coworkers and be like, do you have this same problem with so-and-so? Or, not address it directly with your coworker, right? Because that's anxiety provoking. So, but the way I want to be a leader in that space is what pushed me past the anxiety, but also in deciding workplace culture. I want to be direct with this coworker and not have it become a gossip situation, or go a backdoor way to vent my concern, and then it gets back to her, and now we have a weird social dynamic. So my desire to be authentic, to be leading by example, to be a role model in the setting, and also represent myself and my profession well, I think were things that pushed me to have the conversation the way that I did.
With that in mind, how did your emotional relationship with her, or lack thereof, change afterwards,
Yes.
but also make it easier or maybe more difficult to have that conversation with her?
Sure. So I can be a very flexible person. I'm a very patient person. I value being a patient person. And sometimes that will bump up against this need to be very direct, because I'm like, I want to give people the benefit of the doubt. But then that makes it hard for me to set my boundary, and like, when are my boundaries being violated in this dynamic? And so I think that was probably the first time professionally that I pushed into a conversation like that, because before I wouldn't have the confidence to do that. Like, I just wanted to keep the peace, right? But this time I'm like, oh, I'm going for the conflict because of the benefits, not just to me, also to my client. So,
And
yes.
you've gotten to know me a little over the semester. What advice do you have based off of what you know about me that might help me prepare for conflict situations?
Okay, so at our last meeting, I actually had thanks for the feedback ready, but I'm like, I don't know if the conversation is going there today. So it sounds like you're ready for the conversation to move that direction. I think, I don't have my notes in front of me. I think it's really encouraging to hear how you are aware, like everybody should, I hate to use the word should, everybody would benefit from being aware of those triggers, right? So like what in another person's body language or tone or the words they're saying, like what emotional triggers are being pulled that make me react in a certain way. What did you say Dr. Schmidt's word was?
Leaky face.
Leaky face. So I go back and forth about that, because if it's like, I think there's a professional way to control our face, but if I never show what I'm feeling, that person across from me might not take me seriously. So like, knowing the how much and when, right? If I'm confused, I'm not gonna sit there and be like, I'm so confused, because it's mixed messages, right? So knowing the when and how to use that, the facial expression, that I just thought about now.
So, based on the interactions that you had with your coworker, the first thing that stood out to me was your emotional intelligence and how hugely important that is for us as OTs. Because not only were you self-aware in your own regulation needs and what was going on in that relationship with her, but also in a respectful way, you were able to see and identify what things might be a barrier for her to receive what you had to say, and some of the red flags that you felt were hindering your session.
Sure.
As well as mediation being an option, which would be involving that manager or that supervisor.
Right.
But your clinical experience helping you to make the decision between, is this the best path?
Right.
Or is it going to be the most effective to go straight to the person?
Yes.
Which is honestly an avenue for incorporating, I guess it wouldn't be faith-based learning, it would be faith-based leadership.
It is.
Because
100%.
bringing your struggle or your issue to the person that you have conflict with,
Yes.
I'll have to cite Proverbs, because I do believe that is very biblical. And the decision to not use the mediation leadership strategy seemed like one done out of clinical experience.
Yes. Yes.
Even the transactional communication model comes to mind.
All right, tell me about that.
Thinking of, I'll show you. You have a sender and a receiver. The channel being the medium that the information is portrayed through.
Yes.
But then there's this process of each person encoding and decoding what they're trying to say.
Yes.
And the noise in between, being in an disciplinary clinic and having so much going on.
Right.
To your point about communication and humans getting along, there is a lot in the way.
There is. I think of thanks for the well, there are parts like about thanks for the feedback that reminds me of.
Yep.
And then what is the team steps?
Yes.
There's this little picture of the 2 penguins on either side of a wall. I don't know if you have.
Yeah, I know what you're talking about.
And it's just there's so many filters that we process information through. Knowing that as a behavioral health related OT, like that does definitely help those clinical skills. That's the one.
The next guest on our show is Dr. Ann Martin. Dr. Martin is experienced in acute care and is going to be talking to us about a conflict situation that arose while she was working in an acute care setting and how she handled that using leadership theories. So, just to start out, if you'd be willing to describe the situation that you had first with your coworker and where the disagreement or conflict arose from, and just kind of tell the story of what happened and how you handled it.
So this was an acute care, and I and a PT were both scheduled to be our post-op day 0 therapist on ortho. So we were seeing joint replacements the day of surgery. So I had a patient caseload in the morning that was pretty, and I was working, it was lunchtime and I was working on my notes, and I had a couple more people to go see, and it was right after lunch, and I was trying to come up with a game plan for the rest of the day. So I'm at my desk, PT is working nearby, and I asked her once, like, what time do you want to go see the patients? And never got a response from her. So I asked again, and when I asked the second time, she yelled at me to shut my mouth. In the middle of our therapy department with probably, it's the middle of the week, so there's probably about, I would guess at that time, 15 to 20 other people around. So at that point, my blood was absolutely boiling. Also, I'm a very emotional responder and trying not to cry in that situation. So pulled myself together, left the office because I was like, I can't speak to her right now in a way that would be productive at all. My feeling at that time and continued towards her is I felt like she was kind of a bully, and that if I would have talked to her in the moment immediately after, I would have gotten emotional and she would have gotten, in my mind, defensive and kind of snappy at me. Like, that's how she responded frequently to people. Mm-hmm. And I respond emotionally. Like, it would have just been bad. So I left the office still knowing that I had to go work with her in about 3 hours, maybe 2 hours. So,
and just to clarify, you were co-treating.
We were co-treating, yes.
Okay.
Because on post-op day 0 with patients, they're so medically unstable that having 2 people there was necessary. Mm-hmm. So yes, we were going to do co-evaluations about 2 hours after she yells at me in front of people. So sat there for those 2 hours, obviously thinking about it the entire time. Time to go treat those patients. Before we started, I'm like, we need to talk. And I said, I didn't know, you didn't answer me, so I didn't know if you heard me or not. That's why I asked a second time. And I apologize for asking twice or something. I'm like, I'm sorry for bothering you 2 times, but I didn't know I didn't know if you heard me or not. And I go, but it is not appropriate to yell at me in those, in front of everybody. It's not appropriate to yell at me at all in a work setting. And she said, yeah, you're right. Apologized for it. And moving forward, I always, we were kind and friendly to each other and had a working relationship, but I also never probably, I would say, fully trusted her.
My first question is, how did that session go immediately after? Do you feel like you were both able to set aside some of those emotional barriers and treat the client and leave everything at the door?
I would say in general, yes. Like, we walked in, we did our job for the client. I don't really remember. I feel like I might have like kind of blacked that part out. But I do think that like I'm sure after those clients, a lot of times with other PTs that I would call about in those situations, joking, a little more laid back. I feel like after that, especially with those clients in that day, it was very much get a job done, do this, and this, and didn't have necessarily like the relaxed feel that probably happened in the past and happened with other therapists.
Mm-hmm. How do you feel that she implicated certain strategies to treatment? As far as, was she accommodating to you in the session? Was she in the past at all? I know you described her as a bit of a bully. What did that look like in your sessions?
It never was in the sessions. Like, she was very good and very kind to patients. I feel like it was more feeling towards like coworkers, and it was kind of like we do it this person's way, not anybody else's.
Thinking of leadership and conflict resolution theories, how do you decide what's most important, whether that be mediation, going directly to the person and dealing with the issue, or coming at it from an emotional standpoint and those underlying interests and like an interest relational based approach?
I think if it's the first time and it's something that is very like specific and concrete, though, like, you definitely just need to go to the person, like, and have those conversations with the person is hard, no matter how hard they are for you, because in general, OTs don't like conflict. I really don't like conflict. I don't want to do it. Like, that's my personality. But that situation was so much black and white and so much like, I felt this way. We have to work together. I felt very much I had to address the elephant in the room before we could ever walk into a client or a patient's room before. So, and because it was such a concrete thing that I felt like it was easy to talk one-on-one directly to the person. Moving forward, when it became more of like a relationship like differences in how we just kind of saw the world and interacted with things in general, that's when I felt like it was just easier to have that mediator there, so it wasn't a lot of like he said, she said. We're and like a lot of times the mediator my boss just sat there and didn't really say much, but it was always there to have, I think it kept both of us in check. That, like I said, I felt like she was kind of a bully. When that third person was there, I didn't feel that as much. I also can, shut down at times when I don't want to deal with conflict. And so having that third person, that mediator there, I think kept me honest as well. So that's why, a lot of times it was just like, hey, boss, we need to discuss this. And it was always like a bigger thing to discuss. We all meet for 10 minutes. I mean, usually it was, like I said, it was just fine, but it was always like, I think having that third person kept us in check. And it was one of those things that we both felt more comfortable with, I think, moving forward. Because I, at that point too, also had a leadership role. And I think her perspective of me was I was always trying to get her in trouble. And I wasn't, unless it was something that was inappropriate, but I think she felt like I kind of had my eyes on her and was waiting for her to fail. And I felt like she was a bully to me. So, like, I think that's where we really struggled. Mm-hmm. And by having that third person mediator in the room, those kind of things may have dropped away a little bit.
Mm-hmm. Are you familiar with Thanks for the Feedback?
Mm-hmm.
Show and Dylan. I'm reminded of relationship triggers.
Yes.
And your position in leadership contrasted to hers, and how frustrating for both of you that must have been to see this other person in this position and filter everything that they're saying
through this, like, I'm out to get you lens, and I'm full, having this, like, she's a bully lens. Like, yes. It just didn't, like, it was definitely hard. And it was definitely, like, something that every time, like, I got a text from her one night at 9 o'clock, and, like, we need to talk tomorrow. And I'm immediately, like, I felt sick to my stomach all night. And so, like, because I felt so emotionally drained from it, I was like, we need to have that other person there. And it wasn't anything big, but you walk into that room with emotions already that it just worked better to have that mediator there.
Yes.
And I never, we had different views on stuff, and that's probably where she felt like I was out to get her, because sometimes I felt like she had inappropriate relationships with patients, like, too personal, and and that always bothered me from, like, almost like an ethical perspective. And so, like, I think that too, it's so complicated. So that's where she had, like, Anne's out to get me, and I'm like, and I always felt like I was being bullied when I had to have harder conversations with her. And ultimately, like, we both just really wanted to do right by our patients, and it was a little bit, we're coming at it from different angles.
Yeah.
For, like, future things, not the one incident I started with. But.
Yeah. So in listening to you talk about this, I always try to put myself in other people's positions and think about, what would I do? How would I react? And that sounds like one of the most uncomfortable situations you could put me in.
It was awful.
You were so right when you said that. Like, I avoid conflict. I have two questions that kind of go together. How do you feel you motivate yourself to address those conflict situations? And what are some of the perceived consequences of avoiding those conflict situations?
That's it. So, like, I think about if perceived consequences would be, it's going to happen again. It's going to happen to somebody else. Mm-hmm. And, like, that specific situation, like, it's going to happen again. It's going to happen to somebody else. I just gave her permission to treat me lowly. And so that is kind of, like, perceived, this specific situation, how I felt consequences, and looking back on it now, like, those would be, and, like, I was never, like I said, not comfortable, but, like, I had worked there. I was confident enough in my position at that work that, like, and was on the leadership team, so I'm like, I have to step up, because it could happen to somebody else. It could happen to somebody, a new grad, or somebody who doesn't feel like, I can't talk to the senior therapist. I can't talk back to the senior therapist. And it's not talking back to them. It's having this hard conversation. Mm-hmm. But at that point, like I said, being on the leadership team and everything, I felt that it had to be addressed. Like, that was one that I've let other things slide on the rug, but that was one that could never be stopped. Like, had to be cut down then.
Mm-hmm. I'm almost sensing obviously some kind of responsibility that comes with being in a position of leadership. Mm-hmm. But I guess I had never really thought about how conflict resolution and being proactive in addressing conflict was not only like a leadership hat to put on, but also an advocacy hat to put on. Because as a leader, you're an advocate.
You're advocating for every one of your employees. Like, I had, like, I don't know, it was like a peer leader. I was our clinical educator, so it was more like a peer leadership role. Like I was on the leadership team, but I wasn't gonna ever like fire a person. But I think you do have that responsibility as a leader to be the advocate for your team, no matter what that looks like. Like in the hospital setting, you are advocating for your employees as you move up the leadership chain. So you are advocating that the therapy department gets the same respect as the nursing department.
To recap on our time today, I first spoke with Dr. Virgo about a conflict with a counselor where Dr. Virgo relied on emotional intelligence to help her understand what conflict resolution strategies were going to preserve her ability to communicate with her strong-willed coworker. Dr. Virgo's approach resembles an interest-based relational approach. Through her interaction, she focused on preserving relationships while addressing the interests behind the conflict. Collaboration and compromise were two other conflict resolution strategies we can see in Dr. Virgo's interaction. By choosing to give context into the scope of OT and explain the background of the situation, she involved her coworker in a compromise process and opened the conversation for them to collaborate and work together. I next spoke with Dr. Martin about a conflict in an acute care setting where she felt disrespected and made to feel small. What really stood out to me was her off-mic advice about how important it is to have respect between coworkers. When made to feel inferior and, quote, small, unquote, it's nearly impossible to go into work every day, especially in a situation where co-treatment is involved. Dr. Martin beautifully highlighted the responsibility to both oneself and others to deal with conflict rather than avoid it. The theme of emotional intelligence and awareness seems to be connected to the principles of leadership and conflict resolution, as both Drs. Martin and Virgo alluded to using that intelligence to better understand the person on the other side of the conflict. Leaders should be capable of applying a situational leadership theory, or the Hersey-Blanchard model, by being able to adapt their style based on the needs and maturity level of their followers. Anticipating that someone may be more confrontational or have a difficult time receiving what you have to say is a tool to better communicate and address confrontation. For Dr. Virgo, this also meant choosing not to have a mediator. While mediation is a more popular conflict resolution style, Dr. Virgo used her experience and clinical judgment to determine that that approach would not benefit either party and might reinforce communication barriers. Dr. Martin also talked about being a leader for others underneath her. She expressed how addressing that conflict when she could have protected others from a situation that she felt could have happened again. As a member of the leadership team, she took responsibility for having that difficult conversation. This was a way that she demonstrated servant leadership. Taking on that burden and putting herself in an uncomfortable position was paving the way for her peers and even exemplifying a transformational leadership theory where leaders inspire and motivate other followers to achieve more than they thought possible through vision, enthusiasm, and personal connection. In her identifying that her coworker felt like she was, quote, out to get her, quote, Dr. Martin unknowingly alludes to an opportunity to implement a conflict transformation theory. This theory looks beyond resolving an immediate issue to address underlying relationships and systemic structures. There was clearly a point of tension between these two coworkers that began before this conflict. Addressing that issue may uproot the real problem and avoid future conflicts. For future and practicing OTs, even interdisciplinary healthcare professionals, there are a few points that can be taken from these conversations. The first is that patient-centered care must come first. Both Drs. Virgo and Martin exemplify leaving these emotionally heavy and draining situations at the door. This comes with experience and practice, but it is owed to the patient and even coincides with AOTA's Code of Ethics principle of non-maleficence. Exposing a patient to your emotional baggage is to do harm and must be avoided. But don't fret. Our podcast guests have identified tools for us to do just that. I spoke with both doctors about one of my favorite resources, Thanks for the Feedback by Shell and Gillen. If you're unfamiliar, the authors present us with theoretical triggers These triggers are relationship, identity, and truth. These affect how we process information or feedback from others. We saw this in Dr. Martin's interaction where her counselor coworker likely experienced a relationship trigger due to her feelings about Dr. Martin's intentions toward her. Next, I spoke with Dr. Virgo about team steps training and the transactional communication model. Both are great, simple education sources for visually picturing how what we are saying can get distorted by who we are saying it to, how it's said, and everything that happens in between. So go check out those sources to learn more about conflict resolution with coworkers. Lastly, we cannot forget about Scripture as the ultimate resource. What a trove of guidance and information. Jesus sets the best example of leadership and conflict resolution. If you're looking for the perfect template of how to avoid and navigate emotionally charged situations, check out the Gospels, Matthew, Mark, Luke, and John, for some compelling stories. As always, I'm your host, Hannah Mueller, and you have been listening to the Activities of Daily Leadership podcast. Thanks so much for tuning in, and we will see you next time.